Good afternoon, everyone. You are very welcome to the Men's Cancers What to Look For, What to Do and What Next. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to your MC for the day, Programme Manager with Heads Up Kildare, Deirdre Bigley. Thank you.
Thanks very much. You're all very welcome to this afternoon's webinar. I really am delighted to be today's host. My job is the easy job. All I'm going to be doing is, I suppose, presenting to you the experts that are going to, I suppose, help enlighten to all of us today, but also hopefully going to answer some questions that you may have throughout the presentation, but you may even have come within your head today. So without further ado, I'm going to hand you over to our first speaker, Dr. Una Kennedy, who not only has time to run her own practice, but is a GP advisor to the National Cancer Control Programme, and to boot, a really lovely person. It isn't myself and Una's first time to work together, but I am more than delighted to be able to hand over to her today. Una is going to give a short presentation on looking at the early signs and symptoms of men's cancer specifically, and what you need to look out for. So Una, over to you.
Thanks very much, Deirdre, and thank you very much everyone for joining us here today. I will try to get into the slides now. This is the tricky bit. Okay, great. Can you all see that?
Yep.
Great, thank you. So, Deirdre, thanks very much for the lovely introduction. I'll try to live up to it and hopefully deliver something of use to people today. So I'm Una Kennedy. I'm a GP in Dublin, and I'm also the GP advisor to the National Cancer Control Programme. And I'm going to just speak a bit about men's cancer in Ireland. Oh, I'm going to have to stop sharing. I think this is not moving. Just bear with me a second. Right, we will try again. Okay, right, we'll try again. Is it moving for you guys?
Yeah, that's fine.
Great. Okay, so I'll just speak briefly about cancer in Ireland at the moment, and this is the situation as it stands in Ireland right now. We have 21,000 cases of new cancer every year in Ireland. It is now our #1 cause of mortality in this country. It has overtaken cardiovascular disease. We have 112 people diagnosed with cancer every day. 8,875 approximately dying from cancer every year. That's one person every hour. And unfortunately, we know that 1 in 2 of us will get cancer at some stage in our lifetime in Ireland. So that's the present situation. It's pretty grim. Unfortunately, the future is equally grim. The National Cancer Registry did a report in 2019 projecting where they expect the cancer numbers to go, and they expect that between 2015 and 2045, the number of invasive cancers in Ireland will double. So we're 2022 nearly now, we're in the middle of this, and we're in the middle of this doubling of cancers. And this quote is from a gentleman called Dr. Christopher Wild. He's a former director of IARC, the International Association for Research on Cancer. And he said, we cannot treat our way out of the cancer problem. And what he means here is not that we can't or we won't treat cancer. Of course we will and we must, and indeed we can. But his point is that really, rather than waiting for people to get cancer or develop advanced cancer, you get in there early, try and prevent it where possible, and where you can't prevent it, find it early when it's much more amenable to treatment and where the outcomes are so much better. So why do we want to detect cancer early? Well, these are the data for cancer survival in Ireland. And what we have here is the green boxes and red boxes. The green boxes show your 5-year survival if you're diagnosed with stage 1 cancer in Ireland. That's early stage for these cancers. The red boxes show your expected survival if you're diagnosed at stage 4, which is a more advanced cancer. And what you can see looking at this is that actually the survival rates for early stage, for stage 1 cancer, are actually very good. that if you're found with stage 1 melanoma, you have a 99% 5-year survival. Prostate, it's 97%. Bowel, it's 95%. Testicular cancer, 99% 5-year survival. Now, admittedly, lung is very much last in show here with a 50% 5-year survival, but even that is a lot better than you can expect if you're diagnosed at stage 4. And I think it really emphasizes the point that if you're picked up early stage, if you get checked out as soon as you get symptoms, your chances are actually really good in Ireland if you're picked up early. I'll start with the generals on what to look out for cancer and move on to some specifics. And I apologize, this slide is a bit faint. What I'm trying to demonstrate here is the rate of cancer cases by age. And if you squint really hard and look really closely, what you can see is that as people get older, the number of cancers increase. And we all kind of know that intuitively, that cancer is strongly related with age. And as you age, your chances of getting cancer get older, particularly once you hit into your 50s. And these are the common cancers that we would look out for in men in Ireland. In particular, number 1, prostate is the commonest cancer. It makes up about 1 in 3 of all male cancers, followed up by bowel cancer, that's colorectal cancer in lilac there, 13%, followed up by lung, 11.5%, and followed up by skin cancer, that's melanoma, just under 4.5%. And those 4 cancers alone will make up almost 60% of all the cancers that you're going to see in men in this country. So even if we could just keep our eyes peeled for those 4 and pick those 4 up early, we'd be doing very well. Other things, general things you need to look out for. If you're afraid you might have cancer, what would you want to be keeping your eyes peeled for? And this is available on the National Cancer Control Programme website for anybody to access. A new lump or bump, a lump or bump that wasn't there before. A changing lump or bump, something that's been there for a while and is changing, particularly if it's getting bigger. Abnormal bleeding, and that's bleeding anywhere. Bleeding from the bowels, bleeding in the urine, bleeding in the semen, coughing up blood, vomiting up blood, spitting up blood, easy bruising, blood in the bowel motion. Anywhere you might see blood that you shouldn't see blood, that should get checked out. If you have a mole that is new or changing, if you have weight loss that you can't explain and you haven't been trying to achieve by diet and exercise, weight loss that's unexpected should get checked out. If you're constantly very tired or much more tired than is usual for you, if you have a cough that's going on for more than 3 weeks that you can't explain, if you have a change in your bowel habit, particularly diarrhea that's new onset and going on for more than 6 weeks, or if you have heartburn or indigestion that isn't going away, particularly not going away with treatment. So I'll move on to the specific big cancers and just outline some of the common signs and symptoms you might expect for those. Prostate cancer can be difficult to spot because as men age, the prostate enlarges quite naturally. This is a natural phenomenon and it's not something to be terribly worried about. And unfortunately, the signs of prostate enlargement can be very similar to the signs of prostate cancer. But here they are: passing urine more often, getting up at night to pass urine, difficulty passing urine, urgency. And urgency means when you have to go to pass urine, you have to make a run for it, you can't wait. Blood or urine, blood in the urine or in the semen, that these wouldn't be things that would happen in benign overgrowth of the prostate. They would be more worrying. Other things to be concerned about would be if you have a family history of prostate cancer, and prostate cancer is more common in men of African ethnicity. For people who want to know more about this, and in particular, one thing you get asked about a lot would be, should I get checked for the prostate? Should I get my prostate blood test checked? And that's a difficult question to answer in a forum like this. It's very much an individual decision, but if you do decide to get it done, it should be an informed decision. These are the National Prostate Cancer Referral Guidelines. They're available on our website, and there's a lot of information there about getting your prostate blood test checked. It's worth having a look at that. And if you still want to go ahead, or if you need more information, give your GP a call about it. Bowel cancer, again, one of our commonest cancers. This slide was very kindly donated by the National Screening Service. They created these slides for me and sent them on, which was very kind of them. So bowel cancer is the second commonest cancer in men after prostate cancer. We've over 2,800 people diagnosed with bowel cancer every year. But the really good thing about bowel cancer is we now have bowel screening. We have a screening test for bowel cancer. Anybody aged between 60 to 69 can be screened for bowel cancer every 2 years. And the idea is to find bowel cancer at an early stage. If it's diagnosed at stage 1, your survival is 95%. If you're diagnosed at stage 4, that falls to about 11%. So there's a lot to gain, there's a lot to fight for here. And the really good news about BioScreen is it's a great program. They've picked up over 1,200 cancers since it started, and they've removed almost 34,000 pre-cancers that could have developed into a cancer. It's a very good program, but people do need to participate in it. So what do? If you haven't been contacted by them, you can either phone them on their free phone line, or you go online and you register yourself, and they send you out a kit. And in the kit is all the paraphernalia you need. You get a little tube with a dipper in it, dip the dipper into the stool sample and pop it back into the tube, wrap the whole lot up and post it back to BioScreen, and that's it. They check it after that, and if they find there's blood in it, they may invite you for a colonoscopy. So really, you can participate in BioScreen without even leaving the comfort of your own home. In terms of symptoms that you might get if you had early stage bowel cancer, well, watch out for a persistent change in bowel habit. That's particularly diarrhea, going more often, loose bowel motions, and sometimes tummy pain, particularly if it's going on for more than 6 weeks. If you've blood in the bowel motion, it could be bright red blood, or it could be dark or mixed through the bowel motion. If it's dark red and mixed in, they say it's less likely to be caused by hemorrhoids. And if you have tummy pain or discomfort or bloating brought on by eating that you can't explain away, if you have weight loss that you haven't expected, that possibly could be a sign or a symptom of bowel cancer. Now, again, just like with the prostate, these symptoms are very common. They happen normally in the average population. They don't at all mean that you have bowel cancer. They just mean that you have to get them checked. That's more information about BioScreen. That's the free phone number. It's well worth giving them a ring if you haven't heard about them. It's well worth going online and logging in and registering yourself if you haven't been called by them. So lung cancer, as we saw in the earlier slide, it is very much the poor relation in the common cancers. Even for stage 1 lung cancer, the 5-year survival is just 50%, and it drops to a really disappointing 4 to 5% for stage 4 lung cancer. It's not our commonest cancer. It's the 3rd commonest cancer in men in Ireland, but it is our single biggest cancer killer. It kills more people than any other cancer in this country. What to watch out for? Unfortunately, for lung cancer, the signs and symptoms can be very vague. It's not easy to spot. It is easy to miss. What do you look out for? Well, we move to the right of this slide first. You look out for the type of person who's most likely to get lung cancer. They could be male or female. They tend to be older. The vast majority of them are diagnosed over the age of 50, and the median age for diagnosis is 70 to 74 years. Lung cancer is strongly associated with smoking. They may be smokers or ex-smokers, or they may be people who are exposed to smoke, are passive smokers. It is strongly associated with socioeconomic deprivation. And it's also worth remembering radon. Radon is a naturally occurring gas. It occurs in our environment all around us. We can have high levels in some parts of the country, and it can be associated with lung cancer. So that's the type of person who might be at risk. And then on the left of this slide, we have the signs and symptoms of lung cancer. The big one is cough. And cough is very common, unfortunately, but about 2/3 of people with lung cancer kick off with a cough. Obviously, most people with cough don't have lung cancer. Followed up by appetite loss and weight loss. And again, we'll keep seeing this. Appetite loss and unexpected weight loss are something that need to be checked out. A new cough in somebody who's never ever had a cough before, and again, a cough that doesn't go away. And the guidelines would say if you have a cough for more than 3 weeks, that should get checked. If you have chest or shoulder pain, and that particularly refers to a tumour that might be pressing against the chest wall or pressing against the tip of the lung, against the shoulder. If you're easily breathless, more easily than is normal for you. So some older smokers, for example, might be easily breathless anyway. They might say, look, I could always get up the stairs. I could always get to the end of the garden. I can't anymore without getting breathless. And that's the difference. If you're really, really tired, much more tired than is normal for you. And in terms of raised platelets, most people won't know that they have raised platelets. These are for healthcare workers. But if you did have a blood test, if somebody said to you the platelets are raised or and they need to look into it, this could be why. They're just checking it out. Melanoma skin cancer. Again, one of our commonest cancers in Ireland. Accounts for just under 4.5% of all men's cancers. This is what you look out for. It's really, if I had to put in 2 words, it would be the ugly mole. These pictures on the left here are melanoma skin cancers. Everybody can check their own skin, and really you should check your skin for moles as regular as you can think of it. About 75% of people in Ireland have very fair skin, and we're very susceptible to the sun. What we use in Ireland is what we call the ABCDE system, and this is the system you use for examining a mole. A stands for asymmetry. Most of our moles would be nice and symmetrical and circular. If they're asymmetrical in 2 axes, that's a mole to take note of. B is the border. Again, most of our moles would have neat, regular borders. Watch out for an irregular border. C stands for the colour. Again, most normal moles, most innocent moles would have a single tan colour. Watch out for a mole that has different colours within it. D is for the diameter. Watch out for any mole with a diameter more than about 0.6 centimetres. And finally, watch out for evolution of the mole. And evolution means the mole is changing. So you have the mole, and then you notice it's got bigger, it's got darker, it's bleeding, there's little moles popping up around it. Things like that need to get checked out. And again, if you move a little to the left of that last picture there, you can see ugly duckling, and that's the ugly mole. If there's one mole or one growth on you that looks different to all the other moles, get that checked. Moles on men that are worrisome tend to be more likely to be on the back. So you may need to get your nearest and dearest to cast an eye over your back once in a while, just to check that everything's okay. So what do you do? I mean, the most important things are to know the signs, have an idea of what you're looking out for, and know what's normal for you, and know what is a change for you. Be vigilant as well. If you know what's normal for you, and if you see the change, if you're watching out for it, you'll notice it, and then you can act on it. If there's somebody around you that you're worried about, be it a father, a granddad, a brother, a sibling, a friend, reassure them. I mean, cancer doesn't mean that you're going to die. It doesn't have to mean that for sure. If you pick up cancer early, your outlook is really, really good. But the important thing is to get it checked out as quickly as possible. And particularly this applies to smokers. Smokers know that smoking is bad for them. They're not foolish. They do know that it's bad for them. They know it's damaging their health. But the point is, they're hooked on cigarettes. It's not easy to quit. So nagging or complaining probably isn't going to work with them. Gentle encouragement to contact their GP as soon as possible is probably going to be a more effective way to help them. And remember that for many cancers now in Ireland, we have rapid access clinics. So if you contact your GP and if they see you and decide to refer you, they can refer you to a rapid access clinic where you will get seen more quickly. That's me done, and more information can be found on the Cancer Registry website, the National Cancer Registry of Ireland.ie, and on our website at the NCCP, which is hse.ie/cancer. Thank you very much.
Una, thank you very much. That was really comprehensive and quite simple. I suppose as I was listening in the beginning, your first few slides, I was beginning to think, oh, it's not a really good story or a really good scenario. But then I suppose, particularly when I saw your slide around the survival rates at stage 1 and stage 2 was a little bit more reassuring. But I suppose Heads Up is a program that works with men, and so I suppose I'm in the company of men quite a bit as a result, and I'm thinking of them as I'm asking you the next question, and I'm wondering, are there lifestyle choices that men could make that might help prevent cancers or, you know, help avoid them?
Yeah, you're absolutely right, Deirdre, and you're right, it does look very grim, but actually there's tremendous hope there. I mean, they expect the number of cancers will double, but a lot of that is down to the fact that we're all living longer, and so it's actually, in some respects, actually a good thing. In the good old days, we just didn't live long enough to develop these problems, and now we are, so it actually is very positive. And although the number of cancers is going to increase, we know that we can prevent about 30 to 40% of cancers. And as we saw, we know that if we pick them up early, our survival is really good. So there's a huge amount of hope there. So what can people do? The big thing is quit smoking. If you can at all, quit smoking or don't start in the first place. The next important thing, I think, is really keep out of the sun. Either keep out of it or cover up with clothing or put on plenty of sun factor. And one of the reasons I think that's so important for men is that I think statistically men are more likely to play sports, so they'll be out in the open, and men are more likely to be outdoor workers, such as farmers or fishermen, and they whip off the shirt and they work away, and the sun, their skin is exposed to the sun all day. So it's really important for men to cover up and get out of the sun. You need to get some exercise, say 75 minutes of vigorous activity and 150 minutes of moderate activity. That's great for decreasing your risk. Cut down on alcohol, that's really important. And I would also say cut down on red meat. Finally, for men as well, remember your sons, remember the boys, they need to get the HPV vaccine because that will prevent quite a number of cancers. Thankfully, all our babies in Ireland now get the hepatitis vaccine, which helps prevent for liver cancer. And men need to register for bowel screen. The uptake for bowel screen is about 40% in Ireland. It really isn't good at all. If I compare this to the women, it's about 80 to 85% uptake for breast check and cervical check. Bowel screen just isn't getting picked up, and the uptake is especially low amongst men. So really, men need to get onto it and start logging in and registering themselves.
Okay, can you just remind me again? So if I were to go in and log in and register, then what happens? What happens next?
It's really easy. And I had a gentleman in with me yesterday, and I registered him there while he was sitting in front of me because I'd never done it before. So you put in your details onto bowel screen, and then they will send you out the kit. So you get this box in the post with all the stuff in it. When I say stuff, it's basically a test tube with a dipper. You dip the dipper into the stool, pop it back into the test tube, wrap it up, and pop it into the post. And that's it. And that's what you do. And they'll call you after that if they want to investigate you further. They may call you for a colonoscopy, or they may not. They may tell you you're fine.
Okay. So actually, it's something that you can do in the privacy of your own home, and which makes it then so much more easy to do, I would think. Yeah. Okay.
You don't actually have to leave your own home to go undergo bowel screening.
Yeah, and particularly when the survival rates are so good, then it's a simple thing to do. Yeah, okay. Thanks very much for that, Una. I'd ask you to stay on for maybe some questions and answers afterwards. For the moment, I'll leave you off. Thank you very much. Okay, next I'm going to invite Finian Murray, who is an employee with the HSE, and Finian is the Senior Health Promotion Officer with a specific focus on men's health. So I suppose that's most certainly one of the reasons why he's here today. His main work is the implementation of the Healthy Ireland Men's National Health Action Plan for 2017 to 2021. He also is the coordinator of the Engage National Men's Health Training Programme. So Finian, definitely some good kudos there and good qualifications to have you online today. And Finian is going to spend the next few minutes talking about what to do. So we've looked at the signs and symptoms, and now we're going to look at maybe how to engage men or what to do. Over to you, Finian. Thanks.
Okay, good afternoon, everyone, and thanks for joining the webinar. Yes, so I'd like to begin by sharing my screen. So maybe I'd like to begin with a little quiz, if that's okay. See, can I find the? This thing is not getting out of my way. I need to start sharing. But anyway, this is the quiz. Basically.
Sorry, Finian, is it you're trying to put it into presenter mode?
Yeah, no, I'm trying to just. I'm just trying to show it as a screen. Show it.
Yeah.
But there's a black thing in my way. How do I get that up?
If you just hold that bar and pull it down, it should pull down on the screen, and then you can select slideshow from the beginning.
Every day is a school day. Thanks very much.
You're welcome.
Okay, right. So, and then I need to go into presenter mode. Is right. Okay, and then I can push that back up again. Out of the way. Okay, that's great. Yeah. Okay, so the first one, is it a myth or is it a fact? You can catch cancer from other people, and some of this Una would have already covered. And the first one, of course, is no, that's false. Cancer is not contagious. The second one is cancer runs in the family. And this too is false, because most families tend not to run in families, as only 5 to 10% of cancers are due to family history. Number 3 is cancer cannot be caused by knocks and bumps. And that's true, because cuts, bruises, broken bones, etc., do not cause cancer. Number 4, pesticides cause cancer. That's false. However, what we do know is there are clear links between many industrial chemicals and some cancers. So if you work with these chemicals, wear protective clothing. Number 5, if you get cancer, you will die. That's obviously false, and Una covered this very well. There are now very effective treatments for most types of cancer. Many people can be completely cured, others can be in remission and treatments, and they can be effective in slowing down the disease for many, many years. Number 6 is regularly eating burnt meat cooked on a barbecue can increase your risk of cancer. And that's true because eating burnt meat regularly can increase your risk. 7, mobile phones cause brain tumors. That's definitely false, but the monthly bills can be pretty life-threatening. Number 8 is masturbation causes testicular and prostate cancer. No, this is definitely false. There is research showing that in Australia a few years ago, it showed that if you engage in masturbation as a young man, it was a protective factor for prostate cancer later in life, believe it or not. Number 9 is living under power lines causes cancer. Definitely false, even though it's a popular view, but there is no evidence. And 10, men also get breast cancer. That's true, even though it's quite rare. There's about 37 cases of breast cancer every year. So on the engaged, now you hear I lie, I have a tumor, and you ask me where's my sense of humor. So on the engaged training course, we have what we call the men's health engagement jigsaw. So these are the 12 steps, or the 12 things that have come up in the evidence in terms of how to engage with men around health and well-being. So you can see them there. It's a positive approach, finding a hook, hands-on approach, male-friendly, accessible services, communicate appropriately, focus on marketing and initial contact, experienced service provider or facilitator, involvement in the program delivery, strive for better practice, plan small and realistically, and challenge male stereotyping. So I'm going to go through each of those. The first one is adopt a positive approach to men's health work. And, this is very important because we have to see men from their strengths point of view. There's a term we use in the engaged training course called salutagenesis. And actually basically that means it's working with men from a strengths point of view, not from a deficit, not looking at what's wrong, but actually looking at what men are good at and building on that. And men work best with those who believe they are people of worth rather than a problem to be solved. So that's very, very important. The second one is finding a hook and provide innovative services that will appeal to men. So this is very important, that there are opportunistic times when we can reach men. For example, when men become fathers, they are more inclined to connect with health messages and health programs. We've also found through the research that when men are entering retirement, or whether they are, unemployed and so on, these are other times when we can use the opportunity to connect with men. Even if you're running a program, just actually put on health checks as part of the program, and we find that men like that. And also using competitions, challenges in Irish Rail. They had this competition called Gutbusters, where it was a competition for men to lose weight, and there was one group actually lost 13 stone as a group, which, as they said themselves, was like actually losing a man. So weight loss is a good program to run with men. There's also Men on the Move, which is also about physical activity, working with men to lose weight. The next one is to adopt a hands-on approach and make sure that there is a clear focus to the work. So men like to fix things. So if you can run a program that's very much task-oriented, for example, the Irish men's sheds, that's why men love the sheds, in that, they're actually working together side by side, shoulder to shoulder, and they're working on a task. And you know, it's a great way to engage men around health as well. And in the Irish Men's Sheds Association have connected a lot with the health messages in recent times with a program called Sheds for Life. So we are delighted with that. And also that, you know, you have a high level of server user participation. So you make sure that the men are involved in the program, and also that you're very clear what the program is about. Men like that. In terms of the making services easy accessible, we find that you know, using premises that are easy accessible, something as simple as, you know, if there's a bit of parking outside, just for men to drive in and park nearby. And then also services outside normal hours seems to work very well for men. You know, they can pop into the service on the way home from work or on the way to work and so on. It's about bringing the programs to men, and men are more relaxed.
Apologies, folks. We appear to be experiencing some technical difficulties.
Okay.
Hi, Finian. We
Yeah.
just lost you a moment ago.
Okay.
So
oh yeah,
you're
back my internet is unstable.
Okay. Would you like me to share your slides for you, and you can just continue presenting? Would that be more convenient?
Yeah. Okay. Okay.
Yeah. Perfect. Bear with me now, just one moment, and I'll.
Will I stop share? Will I?
Yes, please, Finian, if you don't mind, and I'll share it for you.
Yeah. Maybe if we get rid of the virtual background as well, sometimes that can help. Okay. Oh yeah, so that's so it's the whole thing about creating male-friendly environments. Like, you know, like actually these are very important as well in terms of men. You know, using language that appeals to men. It's sorry the that the environments are open and friendly. That you have positive images of men on posters. This is very important, because what we found is some men have said that they've gone to the GP, for example, and the first poster they see is it's a crime to hit a woman, and it shows a man on the poster, and that's a very negative image of men, and the men automatically feel on the back foot. So just be careful of your images on posters, and try and ensure, like, you know, maybe privacy where possible. You know, health screening in the workplace is a very good example of working well with men. And the next one, do you want to hit the next one? Yeah. Communicate appropriately with men. Like, use language that appeals to men. Language that's not deficit based. It's not saying that men are a problem, but it's more open language. It's more respectful, and even when you're working in a group, you know, make sure that your own body language is comfortable with men, and that you're also comfortable with the male approach, because sometimes working with groups of men can be boisterous and they like the banter and so on. So just try and be comfortable with that. And also, one of the recommendations is that, you know, use child-focused language when you're working with fathers. That's very important, because fathers appreciate that. And when you're working with men, also allow time for discussion. So that's the next recommendation. You can move on there, Helena. Thanks. Okay, and the next one, yeah. So the next one on the list was focus on marketing and making initial contact. So, like, one of the best ways to get men involved is to contact the man in person. You know, sometimes it can be just make a phone call and invite him to the service or invite him to the program, and that can help get your numbers and get them in, get bums and seats. Also, word of mouth. You know, like, men can spread the word themselves. So if you get men to kind of help you to recruit men for the service or for the program, get the men themselves to advertise it. That seems to work. And also, don't be afraid to use gatekeepers. Like sometimes a man will attend something because his wife has told him about it, or his GP. Or even a local newspaper, the local networks, and make sure then, as I was saying earlier, you have a clear outline of the program or the service, and you collaborate with men from the start. I think that's very important. Number 8 then is ensure there is an experienced service provider or facilitator, and that facilitator needs to promote inclusiveness. The sex of the facilitator is not all that important. What men appreciate more is that the person is experienced and knows what they're doing, female. That's what we have found through the research, and that the facilitator also breaks down the power differences between themselves and the group. That's very important. Number 9 then is consult with men and involve men in the program development and delivery. So when you involve male clients, that the men themselves then will be they'll be more invested in the program. So that's very important. So, and then men should be included in all aspects of the service delivery. That's one of the other things we found from the research. The number 10 is then striving for higher standards of better practice in the future, and that there's to improve the use of evaluation information. Always be looking for additional research. For example, the Email Matters is a magazine that comes out from the Men's Health Forum in Ireland every month, and that gives all the latest research around men's health on the island of Ireland, but also across the world. So that would be a good one to subscribe to, just to keep yourself up to date with what's happening around men's health. And you have to remember, we are the first country in the world to have a national men's health policy. So we are world leaders in this area in terms of research and high standards and so on. Other countries are looking to us. The number 11 then is to plan small and realistically. I think if you think short term and build slowly, it's there's a phrase, how do you walk 1,000 miles one step at a time? So just actually think short term and build slowly and build on that, and also focus on quality. It's not really about numbers. When you're working with men's health, like roughly you'll only get about a third of a group of men together compared to women. So don't be put off by small numbers, because that third then will really engage when you get them on board. And it's important as well to provide a range of programs so that men can have a choice. Requirements need to be considered from a resource point of view. So make sure you have the resources to meet the program, and not abandon it halfway through, that you have it at the outset. And then number 12 is challenge male stereotyping. So it's important to understand and respect difference, and it's about listening without prejudice. It's don't ask anyone to do what you haven't done yourself, and you ask men to participate at their own pace. And this whole thing about imagine walking in another man's shoes. There's a joke going around that says, before you judge somebody, walk a mile in their shoes, because that way you're a mile away and you have their shoes. But that's important to imagine the thing from another person's point of view. Just a few of the different things as well. We have learned through research that men are more reliant on exercise than nutrition to maintain a healthy weight. So if you're running a reducing weight program, try and incorporate it through physical activity. That's where Men on the Move is such a success. Men prefer community settings or sports clubs to healthcare settings. The intervention should be based on behavioral change theory, including family and friends. Adopt a family-based approach that revolve around creating safety, trust, rapport, and meaningful relationships with men. Use strong positive messages that encourage men to engage with services without amplifying shame or blame. Connect positive masculine identities with being healthy and productive. Reflect the wishes of men to maintain control and to engage with services on their own terms and in their own way, and share men's stories to show common challenges to foster peer support and create community setup. So in summary then, what does a men-friendly service look like? It's connecting masculine ideals. It's connecting connecting masculine ideals like autonomy, control, resilience with being healthy. So if we could get the message out there that, that phrase, a real man, if a real man looks after his health, if we could get that message out there, we would get more men to get involved in men's health. Also using positive messaging to promote change without amplifying guilt or shame. Using testimonials to encourage other men to take ownership of their health. We have found when we've got some celebrities involved, like for men's health, we had Tony Ward one year, a lot more men, were interested. So getting people, famous people who open up about their health, that helps other men to do the same. And using established men-friendly approaches, self-monitoring, goal setting, peer support, friendly competition, social interaction, camaraderie, and team spirit and branding. They're all things that work in terms of men's health. And the next slide shows a very good website called malehealth.ie, and that's run by the Men's Sheds. It's based on a similar website in Australia. And basically, if any man out there has a health issue, if you go into that website, it'll ask you for your age bracket, and then it'll link you to all the main issues that men would suffer around, at that age group. And it's one we can stand over because the information comes from all the reputable sites like the Irish Cancer Society, the Irish Heart Foundation, HSE, and so on. So it leads a link into the proper health information. So that's a great success as well. And also then the next slide shows that it's Men's Health Week. Every year we have Men's Health Week, which is the week before Father's Day, and it's in June, which is Father's Day is the third Sunday of June every year. And we've had huge success with Men's Health Week over the last number of years. You can see there on the bottom right-hand corner, like actually this year's one was called Making the Connections. It was about reconnecting after COVID. So it was a great success, and we have about 70 to 90 different partner organizations who help us roll out Men's Health Week every year at this stage. So it's been a great collaboration. And just also to let you know that there is a spot cancer early manual for men by the Irish Cancer Society, which reduce your risk of cancer. I'm not sure if there are any hard copies still available, but if there are, you can just contact the Irish Cancer Society. But it's a great little booklet. It's a great little booklet for men around how to spot cancer early, and also the prevention of getting cancer in the first place. Next slide, Lena. Okay, so that's me there. Any burning questions?
Wow, Finian, very comprehensive. I suppose I was busy ticking mentally in my head around your rules of engagement and creating that male-friendly space. And I was thinking about the work that I do and the team that I work with. And I was thinking, yeah, we do that. Yeah, we do that. Yeah, we could be much better at that. So yeah, really comprehensive and hugely useful. And I suppose in Heads Up Kildare, we see that men are becoming more proactive, I think, in engaging around their health and well-being. But I suppose in your experience and indeed in your work, given that you have a far more national remit, do you see that men are becoming, is there a culture shift? Are men becoming more proactive in terms of engaging in health and well-being?
Yes, definitely. We are finding that. We are finding that over the last 10 years or more, that men are beginning to engage more around health. And I think a lot of it is down to the younger men, because there have been so many role models like Brazilians, people like that who've opened up around mental health. So a lot of young men in particular feel it's okay for them to talk about their mental health, and if they're suffering from anxiety or depression and things like that. So that's a huge cultural shift we've seen in the last 10 years as well. And it seems to be bearing out in terms of life expectancy, because we are living roughly about 5 years more now than we did maybe 15 years ago. So a lot of these men's health initiatives that we are actually working on, we're beginning to see them bear fruit now, because the life expectancy for men is increasing, and some of it is down to the work that we're doing. And then also around, you know, things like physical activity and things like that. Like more and more young men are going to the gym, and they're getting their half-hour exercise 5 days a week and so on. So that's a huge cultural shift as well. But there's still a few things that men need to do. Like as men get older, they're less physically active. So if you could encourage men to stay active for longer, would be a huge improvement. And also, if we get men to eat more healthily, because I don't think men eat as healthy as women do. So they're just two areas we would like to see improving. But even something like smoking, Una mentioned it earlier, like less men are smoking now than maybe 10 years ago. It's down 19% of men smoke now compared to 30% about 10 years ago. So there are huge improvements in health. Men are definitely engaging more and more with their health, and long may that continue.
Good. So it's going in the right direction, or it's going in the way in which we want. And I suppose one other really quick question, because I am keeping an eye on the time, and that is, I suppose, how important is it, or is it important to have an evidence base when it comes to looking at how to engage men?
Yeah, that's what I was saying in one of the end slides. You know, that if you can keep up to date with the latest research around men's health, that will give you the confidence and the ability to work better with men. And there's I think the best way to start is to go into the website mhfi.org. That's the Men's Health Forum in Ireland website, and every report and every publication on men's health is available there. And also there's an email matters, as I was saying. It's an electronic magazine that comes out once a month, and it gives all the latest research around men's health across the world. So if you just did those two things, that will help you keep you up to speed. So then when you are working with men, you have a lot more to say, and you're also a lot more confident that you're up to date with the research and the skills that are needed for that work.
Okay, brilliant. Listen, thank you very much for that, Finian. I am going to leave you off there for the moment. And I suppose before I introduce our next guest, what I would like to do is just for us to play a short video. The HSE ran a campaign during the summer. It was the Sun Smart campaign, and we have the star of that campaign coming on in a moment. But maybe before I introduce Ken, we might just take a moment to look at that video. Helena, if you don't mind.
My name is Ken, and I was diagnosed with skin cancer in 2014. My wife persistently encouraged me to see my GP as I had a growth on my skin for a long time. If I'm honest, I didn't want to get it checked out. The GP sent a sample off for analysis. A few days later, I got a call from my GP and I was told I needed to come into the surgery. When I hung up the phone, my wife said this must be serious. I went to the GP just before Christmas, who confirmed there was a malignant melanoma, a form of skin cancer. I still didn't understand how serious my situation was. It was a nerve-wracking Christmas and New Year, waiting to see the consultant as I was given a date for surgery in January. I needed surgery and had 5 lymph nodes removed in hospital. I urge people to protect themselves against the sun damage. If I had protected my skin by using sunscreen, staying out of the midday sun and covering up, I may not have developed melanoma skin cancer. Even here in Ireland, we need to protect our skin from the sun, especially from April to September when the sun's rays are at their strongest. If you are concerned about a change or growth in your skin or a mole that is changing or getting bigger, you should always see your GP.
Great, thank you very much. Ken, I'd like to welcome you onto the screen with me. Lovely.
Hi there, how are you?
Not too bad, not too bad. I'm sure you're probably as delighted as I am to see yourself on the screen there.
At last.
Yeah, absolutely. Yeah, your moment in the sun. But I suppose more than anything, I suppose before I ask you any other questions, how are you feeling now? How are you doing?
Great. I see my consultant every 3 months. She checks my skin. I'm actually back there now in a couple of weeks' time for another checkup. So I'm there every 3 months. at the moment, and then it'll eventually be pushed out to about 6 months.
Okay.
Eventually.
Great. Okay. And I suppose what motivated you? I mean, I heard you there in the video saying that it was your wife who encouraged you to go. But I mean, do you think had she not, would you have ended up going to the GP eventually?
No, definitely not. No, it was there for such a long time. It was there, and it started to get a little bit bigger. It was Louise who knows it, and I was like,
Right.
no, it's not getting bigger now, but it is. So she actually made me go. I had to go.
Okay, she made you go. Well, she encouraged you, let's hope.
That's it. Yeah, that's it. Yeah, it's funny. The consultant actually said that most men that end up in our surgery have been put there by their women, with their partners. Their partners are the ones who bring them there constantly. So it was 99%, I think, of men that ended in our office was because of their partners. Okay,
so is your advice then, Ken, are you actually saying, gentlemen, listen to your partners?
Yes,
listen to the women in your life. No,
they're always right. Always right.
But now, look at, you heard it, folks, it was from the man himself. I almost fed it the line to him, but he gave it to us himself. So was there anything else, I suppose, or what did you learn, and what advice would you have for anybody who might be listening today, who might be thinking,
go to your GP, get it checked out. It is important. I mean, as I said, I wouldn't have went, only for I was encouraged to go. But it is important. Had I used sunscreen, also would have maybe prevented it as well, because I was lived in Spain for nearly 13 years, so I was a sun worshipper, so it was a bit of a wake-up call as well.
Yeah, absolutely. Mind you, it's hard to think about the sun on a day like today when I'm sitting here in my kitchen and I'm frozen. So yeah, no, absolutely. Okay, listen, Ken, thank you so much for that really positive message. And it's people like yourself. I mean, you heard Finian saying it. It's testimonials from other people who have, I suppose, gone through the experience and have come out the other side. So really appreciate you coming on today and sharing your story. So what we might do is invite, and stay on, Ken, please, our panelists, because a number of people submitted questions in advance, so we might have everybody. Thank you very much. So I'm wondering if there was any of those questions. Helena, I don't have them. Is there any question in particular that's outstanding that people may want to ask our panel here today? Or indeed, if the panel has anything that they thought, oh, I forgot to mention that, or I meant to mention that you would like to share now with everyone? No.
So Deirdre, there was one question, well, there's several questions, but the team in the back have been brilliant at replying. But one of the questions was, what are the first signs of bowel cancer?
Thanks, Helena. So who'd like to take that? Una?
Yeah, that's fine. Yeah, they're not as tricky to spot as some of the other cancers. And thanks very much for the question. The ones to watch out will be blood in the bowel motions. If you're passing blood, particularly if it's dark red, if it's mixed in with the bowel motion, if you have a change in bowel habit, and that particularly means diarrhea going on for more than 6 weeks, if you have weight loss you can't explain, if you can feel a lump or bump, or somebody else can feel a lump or bump in your tummy that you can't explain. And also watch out, particularly people who have a strong family history of bowel cancer. You can find out what family history means if you go onto our website. And also if you have a long and say difficult history of inflammatory bowel disease like Crohn's or colitis, that can raise your risk as well.
Okay, great. Thank you very much. Una, I have two other questions here that have come forward. And I suppose the first one is when is too early, or when do we start looking out for signs and symptoms?
Oh, do you know what? I would argue that we probably always should just be alert. But certain cancers affect people at different ages. Most cancers, or the big rise in cancers, occurs when you hit the age of 50 plus. But look, don't be fooled. You can get cancer at a younger age than that. Melanoma tends to affect younger people, and testicular cancer tends to affect younger men as well. So it's never too early to start, and never too late to become aware, and to get into the habit of checking and just monitoring your own health.
Okay, yeah, good advice, Una. And the next question, I suppose I'm going to ask Una for you not to answer, if you don't mind, but I'm going to address it to the two gentlemen in the room. And that is, I suppose, how can you support a partner or a brother or a friend to go visit the GP. Well, like, gentlemen, what can we do as their loved ones to encourage them to see the GP, to go see somebody lovely like Una?
I suppose you got to listen. They got to listen to your partner. They are right. It is important to get it checked out. Anything at all. So just being there, even talking to my brothers and my father as well, and also at them about sun cream, and since this happened as well. So I'm on at them all constantly about what wearing protection in the sun and that.
Okay, great. And Finian, do you have any particular advice as to how?
Yeah, like what we found is that men are very reactive about their health, so they tend to go when they feel something is wrong, and even then they're, as Ken was saying, they're encouraged to go from their partners or from some woman in their lives. But what we would like more men to do would be to be a bit more kind of proactive about their health. So in other words, from the age of 50 onwards, go for your annual checkup with your GP, and if only to put your mind at ease, and it doesn't have to be like a bells and whistle checkup. It can be just a cardiovascular checkup. It could be something simple. Get your blood pressure checked and get your bloods done, and so on. And then if you get the all clear, you're okay for about maybe 2 years. So from then on, just try and get an annual checkup, or definitely a biannual checkup from the age of 50 onwards. And if you had to have if there's a family history of cancer in the family, you should be doing that definitely every year, because it would be a higher risk for somebody like that. But definitely, what we're trying to do is encourage men more and more to go for their annual checkup from the age of 50 onwards.
Yeah. I suppose when you think about it, we get the car NCT'd, and this is, I suppose, something similar. It's about getting our own bodies NCT'd to a degree, isn't it? Yeah, exactly. So I suppose, Una, this next question is probably aimed at your good self, and I suppose that's, how do we recognize testicular cancer?
Oh, it's fairly straightforward. I didn't attend to testicular cancer in the talks. I didn't think I'd have time. It's not a very common cancer. Thank God in Ireland, we'd have less than about 200 per year. And the survival rate for testicular cancer is really good, whatever stage you're diagnosed at. So again, it's a bit like breast health in women. You just get used to checking the testicles, check fairly often, and what you're looking for particularly would be, say, a lump or a bump in the testicle. And sometimes people find a lump or a bump and it's nothing. It's a swollen vein, it's the epididymis, and that's absolutely fine, if that's what it turns out to be. But if you know what they're like normally, and if you find a change, there's a lump or a bump that wasn't there before, or they've increased in size, or they're swelling around them, just get it checked out. And usually the first test is an ultrasound. So just run a scan across the testicle and have a look at it. That's all. So it's benign. It's a harmless and painless test to do.
Okay, great. Okay, yeah, thanks, Una. And I suppose, yeah, that's a simple message. If it wasn't there before, then check it out. Yeah, no, absolutely. Listen, I'm very aware of our time constraints. Can I thank everybody for coming along today, for you, the panelists, for everybody who took their time during lunch to join us, but a particular thanks, if you don't mind, to Ken for giving up his time and coming along and sharing his story. It's really important that we can see what it's like from the other side, or the other point of view. So really a huge thanks to Ken for
you're welcome.
along. Yeah, thanks a million. Okay, that's it, folks. I suppose what I would like to do is, just before we sign off for today's event, and that is just to say to you that Heads Up are running our next programme in Selbridge in January in 2022. I say it's in Selbridge. It's actually, unfortunately, because of COVID, going to be run online, but you can see there online our poster for the programme that we're going to be running in Kildare in 2022 in January. So that's all from me. Thank you all very much, as I say, for your time and attention. All of the links were given out in the chat during today's presentation, and please do check out the different websites that were named. And Helena, I think we have one final slide to finish today's event.
Would you like me to reshare the poster?
Please do.
Okay.
Okay, Thank you very much, folks. That's all. And hopefully we'll see you all again soon. Take care.
Thanks, Deirdre.